Courtney. I'm going to be your nurse today. How are you?
Good. Nice to meet you.
Nice to meet you too. So if you want to get seated and we'll get started.
All right. You want me to lay down or just?
Yeah, you can just sit for now.
Okay.
So on general inspection, he appears alert and oriented. He's pleasantly interacting for his behavior. He's dressed appropriately for this season. His skin appears fine and intact right now, just upon general looking at him. His limbs seem proportionate to his body height and his stated age. When he walked in, his mobility, he didn't appear to have any limitations, any ataxia, any issues with range of motion. So I'm going to start off with inspecting the skin. So I'm going to just look in general at the skin, and right away I notice it is an even color. I don't see any lesions. I don't see any moles or any freckles really, and it just appears kind of just an even in tone. So then I'm going to start palpating, and I'm just going to kind of palpate the skin, and it feels warm to touch, and I can feel the warmth kind of using the back of my hand. It feels warm. I don't feel any sweating or any coldness, any diaphoresis. He doesn't have any erythema, any pallor, any cyanosis upon just inspection and palpation. So it feels smooth, kind of firm and even on his skin. So after this, I'm going to move to the head and the neck. So I'm going to start off by kind of inspecting the head, and right away I notice it appears smooth. His head appears to be normocephalic, not large or not small. Then I'm going to begin kind of palpating the hair, and the head and the skull feels smooth, firm, kind of even on both sides. I can kind of look in the hair. I'm looking right now for any lesions, and I don't see any. So I'm just going to kind of continuing palpating the scalp, and like I said, smooth, firm, normocephalic. So now I'm going to have him open. I'm going to palpate the TMJ joint. So can you open and close your jaw for me, please? Good. And then can you kind of try to open your jaw against resistance? Good. So his jaw strength, this is for cranial nerve 5, the motor function of cranial nerve 5, and his jaw strength appears to be intact. He's able to open. When he opens his mouth, it's smooth. That was good. Okay, so now I'm going to go over to the face, and I'm going to have you, can you crunch up your forehead? Crunch up his forehead, and he's going to open his eyes really wide, and then close your eyes really tight, and smile, and maybe stick out your tongue. Good. So all these different things are for cranial nerve 7, and then I'm going to have you close your eyes, and I'm going to just touch different parts of your face, and I just want you to tell me where I've touched. So this is testing light touch, and I'm going to do this on each side. Good, and this is for the sensation of the face, which is cranial nerve 5. And so now I'm going to look at his nose, and looking at it, it appears to be symmetric on both sides. I'm going to test the patency of each nostril, so I'm going to include a nostril and have him breathe in. And I'm going to include the other nostril and have him breathe in. So it appears to be patent. He can breathe through his nose, so no obstructions upon that. And I'm going to kind of lift up the tip and use my otoscope to kind of look inside the nose. And I can see the turbinates. They're a light red in color. There doesn't appear to be any swelling. So that's the end of the nose examination. So now I'm going to start with the eyes. And I'm just going to begin by inspecting the eyes. I'm going to look at the outside. I'm going to look at the lids. I don't see any lesions. I don't see any swelling. The eyelashes and the eyebrows are intact. I'm going to lightly just pull down so I can look at the conjunctiva and the sclera. The conjunctiva has some small vessels. The sclera is white. I don't notice any exudate, any type of crusting or anything like that. So the eyes look good upon that. And now I'm going to look at his extraocular movement. So I'm going to ask you if you can follow my finger. We're going to go up, down, over, down, 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 and over, down again. We're going to test kind of the angles like this and like this. So this tests cranial nerve 3, 4, and 6. And those appear to be intact. He didn't have any nystagmus, anything like that. So now I'm going to get my pen light, and I'm going to come in from the side, and I'm going to test the pupillary light reflex. So kind of on coming in from the side, I notice consensual constriction of both pupils, and that's important that they both constrict. I'm gonna come in from the other side, and I notice the same thing. So now I'm gonna have you, if you don't mind, focusing off kind of into the distance, and I'm gonna come forward with my finger, and can you just kind of focus in on it? So I notice once again, both pupils kind of converge into the middle. So now that I've done both those tests, I can say that the eyes are perla, which is pupils equal, round, react to light, and accommodation. So that concludes the eye exam. So now I'm going to inspect the ears. And looking at the ears, just kind of from the front, they appear to be equal bilaterally on the face. They appear to be symmetric. I don't notice any lesions, any kind of exudate or cerumen coming out of the ears. And this is all just on inspection. So now I'm going to palpate the ears. They feel firm. There doesn't appear to be any pain upon palpation. Just going to palpate both ears, and they kind of feel the same, equal bilaterally, symmetric on the head. So now I'm going to take my otoscope, and I'm going to pull back the pinna at this angle. I'm going to hold the otoscope with one hand, and I'm going to kind of look in the ear, and what I can see is the tympanic membrane, and I can see that it's a light gray pearly color. I can see that it's intact. When I was looking at the external canal, I didn't notice any cerumen, anything kind of coming out of it. For the tympanic membrane, I saw the umbo, and I saw the light reflex, which because this is the right ear, I saw that it was at the 5 o'clock position. And while I'm here, I'm going to do the fundoscopic examination of the eye. And so I'm kind of going to stabilize the head. I'm going to take my right eye and look into his right eye, kind of go in. As I'm going in, I can see the red reflex. Then I'm looking in the eye, I see the fundus, I see the optic disc, it's a yellow color, the fundus is red. I see the retinal vessels, which are arteries and veins, and I see the macula, which is a little bit darker than the fundus. So after this, I'm going to look at the mouth, and I'm going to have the client open his mouth, and right away I notice it's pink in color. It appears moist for his lips. I don't notice any cracks or any lesions. Then the inside of the mouth, I'm going to take my mouth stick, and I'm going to kind of use this to open and look at the buccal mucosa. I notice that they're pink and that they appear to be moist in color. I'm going to have him tip back his head so I can look, and open your mouth again, so I can look at the roof of the mouth, the palate, and it appears to be a bit whiter in the front, darker in the back. I can see the tonsils, and they're 1+, so they're not swollen in any way. I see the uvula. So now I would touch the back of the mouth to elicit the gag reflex, the posterior part of the mouth, and the gag reflex is present, and I'm going to have you say ah. So when he says ah, the uvula rises midline, and that's going to test cranial nerve 9 and 10. And then can you stick out your tongue for me? Good, and that's for cranial nerve 12. So that concludes the mouth inspection. Now I'm going to do the neck. So for the neck, can I have you turn your head to each side? Good. Can you turn your head forward and backwards? Good, and then touch your neck to each side of your, yes. Good, so there doesn't appear to be any limitations in range of motion with the neck, and he was able earlier to turn his head against my force, so that shows that the strength is 5 out of 5 for his neck. So now I'm going to have you shrug your shoulders against my resistance. Good, and this is for cranial nerve 11, the spinal accessory nerve. So now, while I'm here at the neck, I'm going to palpate first the trachea. So this is for one finger. I'm just going to kind of palpate down on either side of the trachea, and the trachea appears to be midline. And for the thyroid, I'm going to use 2 hands, and I'm going to use one hand to push and the other hand to palpate the thyroid. And I cannot feel the thyroid, which is normal in the average person. So I'm going to do the same, push with this hand, palpate with this hand. Awesome, and I don't feel any enlargement, any distension, no swelling. So for the nodes now, I'm going to palpate his lymph nodes. I'm going to start with the preauricular, so right in front of the ear, the posterior auricular, which is immediately behind the ear. I'm going to do his occipital, which is in the back. I'm going to feel his tonsils, so have you lift your head up a little bit, feel the tonsils right up under here. Then I'm going to start in the front for his submental. I'm going to use one hand and just feel the front. Submandibular, right here on the sides, and then I'm going to do the anterior cervical, kind of just feeling down here, the posterior cervical, then in the back. And for these nodes, they were not swollen, they were movable, non-tender to palpation. So after I did this, now I'm going to begin the inspection of the interior thorax and the chest. So I'm going to have the patient lie down. And I'm going to begin by just looking at the chest. Right away I notice that he doesn't appear to be using any extra effort to breathe. Breathing is effortless. I don't notice any lesions on the chest. I don't notice any pulsations that I can immediately see with the naked eye. His breathing is symmetric, it appears. And so after I'm inspecting the chest, I'm going to palpate. And I'm also going to palpate the supraclavicular lymph nodes. And I'm actually going to have him sit up again for these because that's the best way to do it. So we're going to have you kind of hunch your shoulders a little bit if you can, and I'm going to palpate the supraclavicular lymph nodes. And then I'm also going to have you kind of raise your arm while I support it. I'm going to palpate the axillary lymph nodes, which I'm going to go up the arm, then down the middle, down the front side, and down the back side. All right, I'm sorry about that. And if you could lay down again. So now I'm going to palpate the chest. So I'm going to start off, I'm going to use kind of the base of my fingers. I'm going to palpate at the base. I'm going to palpate at the left sternal border. And I'm going to palpate at the apex of the heart. And I don't feel any pulsations. I don't feel any thrills or heaves upon palpation. So now I'm going to auscultate the heart, or the lung sounds first. So I'm going to have the patient sit up again. And I'm going to auscultate in a Z pattern across the chest. So I'm going to have him breathe in and breathe out. And I'm going to just palpate or auscultate up here and over here. So upon listening to the lung sounds, I didn't hear any adventitious sounds. I heard different breath sounds in different areas. I heard the vesicular sounds in the peripheral borders. So now I'm going to listen to the heart sounds. So for the heart sounds, I'm going to have him lay down. And I'm going to listen to the heart sounds in the different areas. I'm going to listen in the aortic area. So I'm listening right now in the aortic area, in the second intercostal space, the pulmonic area, which is in the left second intercostal space. I'm going to listen at Erb's point. I'm going to listen in the tricuspid area. And I'm going to listen in the mitral area. And then also while I'm down here, I'm going to palpate the apical impulse, and I'm going to use one finger to do so. And when I feel the apical impulse, it's in the fifth intercostal space. It's short. It's in the first half of systole. It just kind of appears to be smooth pulsations. And yes, so when I heard his heart sounds, I heard S1 and S2. I did not hear S3 and S4. I did not hear any adventitious or extra heart sounds, maybe no murmurs. Heart sounds appeared to be intact. And so now we're going to sit up and start the posterior thorax examination. So upon looking at the posterior thorax and chest, I'm going to immediately notice, once again, he's breathing without any effort. His breathing does appear to be effortless. I'm going to see that no lesions. I don't see any enlarged or irregular nevi. So just upon inspection, skin looks good, skin tone is even, and I don't notice anything else with that. I'm going to now palpate, and I'm going to begin with respiratory expansion. So I'm going to go down, slide down to the level of about T10. I'm going to push in, have the client take a deep breath, and again. And when he took that deep breath, I noticed symmetric expansion upon doing that. So I'm also going to check the costovertebral angle for tenderness. So I'm going to come down here, and I'm going to use the ulnar surface of my hand and kind of hit my own hand in both of these areas. And I noticed upon doing that, was there any tenderness? No tenderness upon the costovertebral angle. So now I'm going to listen to the back, and once again, I'm going to move in that Z pattern. I'm going to start up here and have the client take a deep breath, and then the other. Gonna move down, down,